My name is Lorna Steele. I am the Community Engagement Officer at the Highland Archive Centre. We're hosting an event on Saturday the 13th of October looking at the history of Highland Healthcare, and that's to mark the 70th anniversary of the NHS, but also to acknowledge the longer story of healthcare in the Highlands. We've got a great tradition of producing doctors and having really groundbreaking medical things happening in the Highlands, so we wanted to showcase that in the year of the NHS's 70th anniversary.
I'm taking part in the event because I care about the health service and I'm also interested in the history of medicine. I'm both the chair of NHS Highland at the moment, but I'm also an historian. And in the course of my historical research, I've come across quite a number of doctors, quite a number of interesting doctors, and I'd like to share some of the results of that research, looking back a bit further, quite a lot further than the National Health Service, to the 1700s and the 1800s, because there's an important tradition of Highland medicine.
Hello, my name is Jim Leslie. I run, along with my son, the History of Highland Hospitals project. The reason we're doing this is to try and document the very many hospitals we had in Highland, and much of it forgotten by most of the public, including the health professionals. I will be trying to give a snapshot of how things have changed in the Highlands in the last 200 years, from the start of the Royal Infirmary in 1804 right through to the present day, and particularly in terms of hospital design, how the design has changed, and then my son will be looking particularly at the changes in how people were treated and how that also influenced the hospital design and the number of beds we now have in hospitals, and hopefully give people an appreciation of what we have now compared to what we had then.
We hold, on behalf of NHS Highland, a really extensive collection of health records. These date from the 1790s right up to the present day. We're going to split the display into various themes, looking at nurses training, looking at the treatment of mental health, the NHS itself. We hold a copy of the white paper of the foundation of the NHS. One of the main things we're going to be focusing on is the Highlands and Islands Medical Service, which was the forerunner to the NHS. So this was a Highland template of how to provide healthcare across the very distinct and diverse nature of the Highlands, and that was set up in 1912, and that was the forerunner to the NHS.
The main thing for me that I found out is how bad it was in the past and how good it is now, and it's always a constant comparison when you look back at the records and find how many people didn't make it to hospital, or how many people got an appendectomy on their kitchen table because there wasn't a road to take them to hospital or a hospital to go to. And it was done by a part-time doctor, sometimes just as an emergency, and this happened a lot. So the contrast with the sort of multi-agency healthcare we have now is so great that we really have to put all this down so we appreciate what we've got.
The relationship that NHS Highland have with High Life Highland, and particularly with the Highland Archive Centre, and the fact that these records have been deposited here long term, means that they're publicly accessible. There are closure periods to some of them because of data protection reasons, but the collection is housed here. People from school pupils to architects can come in and look at plans of hospitals, can look at case notes from patients from the 1800s, a really diverse range of things that we house here, and they're publicly accessible. And we would really hope, following this event, that people would come in and ask us some more about the NHS collections, and we can show them what we hold.